Doctors, as neuroradiologists, as humans, we sometimes see things we do not expect, and especially not at the location where we see them, like this tree in a river or a meningeoma intraventricular. This is an example of an intraventricular meningeoma in a 15-year-old girl with low T2 signal, homogeneous enhancement, and low ADC indicative of a cellular tumor. And this is not only remarkable because it's a meningioma intraventricular, but also because of the age of the patient, because intraventricular meningiomas mainly occur in patients between 40 and 70 years. If you see an intraventricular meningioma in a pediatric patient, you should think of neurofibromatosis, and we talked about this in the previous video on meningiomas in general. This is a more typical age of presentation in a 40-year-old male presenting with unsteady gait, visual loss, tinnitus, paresthesia of his left arm and frontal headache. And he as well had an intraventricular tumor located in the trigone with homogeneous enhancement. In the top differential diagnosis in younger patients are glial tumors when you think of intraventricular masses at the level of the trigone. And in patients over 40, a meningioma is in the top 3 tumors. If something seems complicated in neuroradiology, I like to go back to the neural tube when things were simple. And if you look at a 7-week-old human embryo with a crown rump length of 2 centimeters, and these are the same images with the head below here and the head on the upside here, you can see that the neural tube is lined by endomenings and ectomenings outlined in yellow. And the ectomenings, I stopped the outlining here, but it just continues. And if you have the roof plate of the neural tube, so what is going to be the head region, what is going to be the cerebral hemispheres, there's endomenings and ectomenings. And when we talked about the embryology of the deep structures of the forebrain, I also showed this image of the closure of the neural tube. And then the roof plate of the neural tube has to remodel a lot to give rise to 2 cerebral hemispheres. And then the cerebral hemispheres have to grow dorsal and then curve caudally. So this roof plate has to remodel, and it's a very complicated process, very important. And in the depth of the infolding, you get the choroid plexus, flanked by the cortical hem, and just above the cortical rim, the hippocampus is going to arise. So this roof plate was bordering the primitive endomenings, and these are human specimens from a 6-week-old embryo. And you can see the infolded roof plate and the external space. And you can see how the roof plate infolds with the vessels and gives rise to the choroid plexus. So the choroid plexus is like when you put your socks, when you take your socks off and they are inside out, or you take your gloves off and the fingers are inside out. And there's endomenings, primitive endomenings on the inside of the choroid plexus covered by epithelium. And this endomenings can give rise to the intraventricular meningiomas. And as shown, the ventricles grow dorsally and caudally, so there's no plexus in the frontal horns. So the intraventricular meningiomas are mainly seen in the trigone, where you have a lot of primitive endomenings. On histology, an intraventricular meningioma looks like this. From a very nice site, Adventures in Neuropathology, highly recommended. And the intraventricular meningioma is covered by normal choroid plexus epithelium. You might know that meningiomas at the convexity have this so-called mother-in-law phenomenon on angiography. So they come early and they stay late. And you also have that in intraventricular meningiomas. And they have an increased CBV, which might be helpful to support the diagnosis of a meningioma. And you can also do spectroscopy, especially if you have an intraventricular mass in the trigone in a patient under 40. And intraventricular meningiomas have no NAA, of course, because there is no neuronal tissue. And they have an increased alanine, so an alanine peak, and that's caused by partial oxidation of glutamine. But this alanine peak is not specific. You can also see that in, for example, a central neurocytoma, but central neurocytomas occur more in the frontal region near the septum pellucidum. And in the next video, we are going to continue with other intraventricular masses such as central neurocytomas, subependymomas, ependymomas. And when we go to choroid plexus papillomas, we will continue after that with the production of CSF and the lymphatic system.